Be Beautiful. We are talking about your face with our board-certified plastic surgeon, Dr. Joseph Mealy. And first, let me remind you that we'll be taking your calls live on the air with any questions you have for the doctor about plastic surgery. The phone number 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And our caveat, you certainly want to consult your own physician as well before embarking on any medical course. We were talking during the break here, and I've noticed that, you know, times have changed. It used to be, I mean, 10, 20 years ago, when you heard about a star or someone going for a facelift, they'd have the dark glasses on, they'd disappear for a vacation for a couple of weeks or a month, and they'd take you through the back door.
It's still done, but not, I don't think, as often. And certainly there aren't as many people hiding out as there used to be, because it's become more socially sort of acceptable to do that. And I think also because the safety of the procedures improved, the recoveries have improved, people can be seen more quickly, and they're happier about being seen.
Speaking of socially acceptable, we've seen more men getting facelifts.
Yes.
I mean, there have been some high-profile cases. I'm sure you would look at them and be slightly displeased because they maybe have been a bit extreme for your aesthetic taste.
Sure. No, I think most of the time when I'm trying to accomplish sort of a rejuvenating effect of a facelift, I'm not trying to make them look like someone else. And there are certain features that really define faces, and if they're changed radically, they will change the way the face looks. We talked a little bit about adding volume back to the face. Sometimes we will use cheek implants or chin implants in order to complement what we're doing with the changing and reducing the skin, but those have to be done with caution, because if you put too much in those areas, you can change the way someone looks.
I'm trying to think if it's Robert Redford, Chris Christopherson. There's a number of men that maybe it's the eyes that they
it's usually the eyes and the brow, because men, we get away with having saggy upper eyelids. Our eyelids usually are down in our eyes. I mean, George Clooney is a good-looking guy. His eyebrows are as low as they can get without blocking his vision. It looks great on him. It's not something we would want to fix. But when it is fixed, it changes the way someone looks.
Right. Well, they don't have to worry about the makeup creasing.
Right. The makeup doesn't get grabbed and pulled up.
Okay.
I've heard that story.
We talked about this just before the break, and I want to deliver on it. There are some do's and don'ts, and I want to ask you this. So what are some of the precautions a person should have before considering a facelift? I
think with any procedure, it's worth being safe first. So the first thing you want to be sure is if you have other medical problems, which in our 50s, a lot of times when we're doing facelifts, we're starting to get other medical problems. We want to be sure those are well controlled and taken care of. I will often have my patients see their primary medical doctor for clearance, though the real clearance has to come from your surgeon, because they're the ones who know exactly what they're doing. But clearance in terms of making sure that the patient's optimized, their blood pressure is controlled, if they have diabetes, that's well controlled, or any other problems that need to be taken care of and can be optimized are beforehand. All right, well, and to be sure it's safe.
This one's kind of obvious, but is it okay to smoke before having a facelift?
Smoking is always bad. Even if you're not having a facelift, it's worth stopping. But particularly with certain operations, facelifts being number one, tummy tucks, large breast reductions, the smoking will increase the risk of problems with the wound healing, where the wound will actually open and take months to close. The risk is increased six-fold by smoking. So if you think you're just going to sneak a little cigarette before and fool your plastic surgeon, you're the one who may end up getting fooled. It's definitely not worth doing.
Yeah, I mean, there have been some well, at least one high-profile case where, you know, somebody did not have a clean bill of health, and you know, it's major surgery.
Sure. It's a real surgery. We do use an anesthesia for it. I use board-certified anesthesiologists. I use accredited surgery centers, as every board-certified surgeon should. But it's worth optimizing things ahead of time, because that still will reduce the risk.
You know, plastic surgery has gone through phases. Many years ago, there was like this one-stop shopping where you do several procedures at once, and that kind of fell out of favor. And now there are some procedures you can have done along with a facelift.
You know, I think in the face more than other parts of the body, we still combine procedures. I mean, I often do eyelid surgery with facelifts or brow lifts with facelifts, and sometimes we'll do other parts of the body too. We'll do breast augmentation with a facelift. You might not think those would go together, but it certainly can be done. And again, it's a matter of doing it safely. So normally what I'll do is sort of prioritize, figure out what's the most important, and work my way through. If at any point things do not look like they're perfect, because they should be, I'm going to stop what I'm doing and figure out why that's the case. But you know, I think it can be done safely.
So the appeal there is just for a person who's reticent to go under, that reduces the, you know, the amount of times that you to do that. But
reduces the recovery time, certainly, because the recovery times then overlap. But there's certain procedures that are not good together that should be separated, and there's certain orders that procedures should be done in too, and that's why it's important to see a professional and see someone who understands what all the options are and make sure we're not burning bridges before we're trying to fix something.
Good advice. For more information about Dr. Mealy, you can call him at 925-943-6353 or visit his blog at sanfranciscoplasticsurgeryblog.com or check him out on the web at drmealy.com. And when we come back on Body Beautiful, we'll continue our chat about faces and we'll take some of your